We are pleased to be joined once again by our good friend Michellene Davis, Executive Vice President and Chief Corporate Affairs Officer of RWJBarnabas Health. Good to see you.
You too.
Michellene, the initiative I want to talk to you about is called the Social Impact and Community Investment Initiative that your organization is a part of, and has something to do with why we're here today. We're actually doing a program here in Newark at the North Ward Center dealing with police minority relations, one of the many very community-oriented dialogues and initiatives that you're a part of. Talk about it.
Oh, absolutely. So really excited to author the Social Impact and Community Investment Practice for RWJBarnabas Health. Steve, this came really out of the visionary of our president and CEO. I cannot ever help but smile when I think about him. Barry Ostrowski, as you know, is an individual who fully understands that as a healthcare institution, that is the breadth and width of RWJBarnabas Health, that we would be remiss if in fact we attempted to ever think that we were just supposed to be in a community but not of that community.
What's the difference?
Oh my goodness. Well, the difference is that you simply do what it is that you have to do, right? So what we know is that we are there in order to render high quality clinical care to the people who come through our door. But what if we decided that we were going to go outside that door? And that we were not simply going to go outside the door to do health screenings, which is incredibly important at health fairs and other venues, but what if we began to literally look at, well, what are the social determinants that cause you to be a patient of ours in a chronic manner, right? So if in fact you are an individual who consistently comes in through RER, or who we consistently see for a variety of things, perhaps we need to have a conversation around what are the other things that are going on in your life? And how can we better assist you in managing through this lifetime by ensuring that we have connected the right collaborative partners and shored up the right resources to make certain that we're addressing certain things. Let me give you an example. So we can talk about the fact that, well, the thing that costs us the most in healthcare is poverty, and then throw up our hands and go away, right? Or we can take a look at the fact that actually the unemployment rate in certain urban environments is outrageously high.
But that's the role of a healthcare organization?
Why is it not the role of a healthcare organization? It's a role of any anchor institution. And so I really think that what our leader has done is made certain that we do more than just that which is required as a nonprofit healthcare system. We know that the IRS commands that we literally do community benefit. We get that.
As a nonprofit.
As a nonprofit. But what if we were to actually realize the fact that we are here in the communities where we serve for not 5 years, not 10 years. We're not a local, right, bank branch. We are oftentimes in the communities where we have a hospital, we've been there 100 years. See, we employ a great deal of those individuals. And of course, we treat those families, our own neighbors and friends, but we could be more than that. What if we decided to utilize our procurement vehicle in order to do some local spending to ensure that the vendors and the small businesses within the communities where we are situated are actually brought into our institution, and thereby we're also bringing some economic stimulus to the environments where we're serving. What if we decided that it's not just enough to recruit national experts, but what if we also turned an eye toward ensuring that we are helping to do something about that high rate of unemployment?
You mean employ people in the community?
You got it.
I mean, let me ask you this, devil's advocate. Someone says, well, you do that, anecdotally. Like, why does it have to be an initiative where it's concerted, it's consistent, it's focused? Or does it really have to be that?
Oh, well, we think it does, and I will tell you this. One of the reasons why we believe that it does is because of the fact that if, in fact, we only do it in an episodic manner, then that is all it will ever be, right?
No real impact.
You got it. If we literally decide, well, we're going to actually do this with a strategy and a laser focus so that we are truly moving the needle in this space. If we just leave it up to individuals to do it on their own, listen, it's a good thing to do, right? It may make folks feel good, but it will never truly have the positive societal impact that we believe that we can make.
Since Barnabas came together with RWJ and it becomes RWJBarnabas Health, the community engagement, does it become more challenging when the footprint becomes that big?
So really incredibly important. So one of the things that we noticed when we were literally just kind of courting each other before we got married as a system was the fact that we had very similar cultures. And one of the incredible elements about those cultures really had to do with the fact that on both sides of the house, we had a depth of commitment in the area of community health education and community outreach. So we have two large-scale systems doing very well within their own communities, being very well entrenched in those communities in order to have great community partners. So in coming together, it wasn't an issue of how difficult it would be, but it did give us the opportunity to ask, who do we want to truly be to the audience that we serve?
So I want to understand something. Play this out, for example.
Sure.
You're good with examples very often. So I'm a Rutgers guy. You know Rutgers well, right? Mm-hmm. New Brunswick, right? RWJBarnabas Health, very committed to that community, particularly New Brunswick.
Absolutely.
What would this engagement, this initiative you're talking about, mean in a community like New Brunswick, per se?
Well, New Brunswick is such an interesting area because we have such an incredible partnership with Rutgers in New Brunswick. But we have a very wonderful partnership that's brewing right now with Rutgers Newark as well. And so here's one particular thing. And you can pick up the headlines and you will see that we recently announced a partnership with their sports complex where we are literally bringing in sports medicine. We're going to be working together in order to recruit national leaders in that particular space and making certain that we are creating that which is a much more formalized process to really take New Jersey to the forefront in sports medicine, right? So it looks like that in one section, and in another section, it looks like that which we have with the faculty member who is in charge of the public-private partnership for all of Rutgers University.
Including in Camden.
Including in Camden.
Your hometown.
You got it. It means that we have research fellows who are assigned to our facilities, who come in and in an environment like that which I know that we've done with you before around community dialogue, right?
That's right.
We help to usher in a forum and a format of community healing by ensuring that we are orchestrating the convening where we're having safe space for community dialogue around difficult issues, whether or not that is the epidemic of diabetes in Black and brown communities, or whether or not it's something like building trust with police forces in those communities.
Which you argue, I know we're limited in time, but building trust, police-minority relations that we just had, you argue is a public health issue.
It is a public health issue. Listen, you cannot tell me that feeling safe in your community is not a public health issue. It impacts your stress level, which impacts your hypertension. It impacts the way in which you prioritize the needs of your family. It undoubtedly is a public health issue. That when there's violence in communities, we see these communities suffer from PTSD far and wide. And yet we want to act as if they get to wake up tomorrow morning, right? Eat their morning cereal and go off to school. That is not healthy, Stephen. And so one of the things that we're hoping to do is through that partnership is to ensure that we have fellows who are acting as scribers and producing papers around this work. We're going to begin to develop toolkits that will then help other communities in other states and perhaps one day other nations on how to bring about community healing.
Michellene Davis from RWJBarnabas Health, thank you so much.
Thank you.
Well said. We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the New Jersey Education Association, Wells Fargo, Passaic County Community College, New Jersey Council of County Colleges, MD Advantage Insurance Company of New Jersey, the Give Something Back Foundation, and by the North Ward Center. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.